Hi, I'm Jo Davies. I'm the Chief Exec of Wild Young Parents Project. We work with young mums, young dads and their babies across the county of Cornwall. As one of my colleagues, her husband is an anaesthetist and he works in intensive care treating COVID. And he says, where else would I be? And I think for those of us that have done our time in the voluntary and community section, where else would we be? We've always been on the margins of society. We've always been fighting and campaigning for those who experience the greatest inequalities. And looking at the history of us through hundreds of years of voluntary contributions to society, we've been there in difficult times as well. And it's often those difficult times that have inspired us to change the system, to challenge the status quo. It's been interesting in Cornwall because in the first lockdown, we had hardly anyone with COVID. So coming out of that, everyone wanted to come on holiday here, and that felt a bit scary. But it was very exciting. Cornwall lost over 600 million in the first few weeks of COVID in tourist income. So we have families who, those that were working, lost their jobs. Many of them were not furloughed. It wasn't that kind of work. It was more seasonal work that they then could pick up a bit in the summer. But as winter came in and another lockdown, they lost everything. In the first month, in the first month of the first lockdown, 36% of our families ran out of food or fuel. Now, I was scared. I was scared for my daughter, for my mother, for all of those vulnerable people I knew. I was scared of getting COVID. We all were. That feeling of being under threat as a whole community and world is terrifying. But imagine that if you'd run out of food. Imagine if you couldn't heat your home, if you didn't have nappies or milk for your baby, and you didn't know how to care for them. It must have been so terrifying. And I've been so impressed with the way that our families have rallied together and had a sense of identity and have supported each other, not only practically by giving each other advice around childcare and dropping off emergency supplies to each other, but most importantly, psychologically. We've had a significant number of young parents that we've lost through COVID because of the wider impact on their mental ill health. And it's had a huge impact on acute mental illness amongst the young people that we work with who are struggling with so many challenges to the start of family life. And they've pulled together and they've offered psychological support that is so incredibly brave in the most courageous public way. And then we've also had young dads and young mums who've written poems and made films about how they cope with mental ill health, with addiction, with childhood trauma through a pandemic. And they've had the courage to put them on our social media so that so many other families can benefit. And the impact of that has been incredible. The impact of having a friend when you're incredibly isolated and at home alone with a baby is far bigger than anything our services can offer them. I'd like to see Courage taking a really central role in leadership in organisations, with organisations being courageous to tackle what we've found and learned from COVID. COVID's shone a huge spotlight on health inequalities, and we can't ignore that. We can't ignore the voices of communities that have said enough is enough. It's unfair that us and our children are experiencing a pandemic in a way that those who are wealthier and better resourced are not. That's our role in the voluntary sector, to take those voices and amplify them and influence those that can make change for that